The National Institute for Communicable Diseases has confirmed a fifth case of monkeypox in the country with 323 tests conducted. The Health Ministry has raised concerns on the growing numbers, but scientists advise there is no need for mass vaccination at present as the outbreak is under control. We're joined now by Higher Health CEO, Professor Ramneek Ahluwalia. Professor Ahluwalia, good evening to you. Thanks for your time. Of course, there's, great concerns about the monkeypox cases that have been discovered in South Africa. Your approach as Higher Health?
Good evening, Kathy, and thank you, everyone. Kathy, first of all, as everybody's saying, there's no need to panic. This is not COVID-19, and this does not spread like an airborne disease. It is a milder, the concern is it's a milder version of smallpox as a vaccine. And sorry, Kathy, there's a call that's coming in. I'm very sorry for the background noise, but I'll keep talking about.
All right,
so that
Professor Ahluwalia, let me do this. Let me give you a couple of seconds. Hang 10. We'll continue with that interview in a moment. Well, let's continue then with that conversation on monkeypox. The Higher Health CEO, Professor Ramneek Ahluwalia, back on the line. Professor Ahluwalia, good evening again. So we of course, we're still just talking about the worries and concerns around the spread of monkeypox right now.
So Kathy, sorry for that. But Kathy, the point is that there's no need to panic at this moment. It is not an airborne disease, and it's not like COVID-19. The concern why we are all worried about is because it comes from the family of smallpox, a virus which is predominantly the most devastating virus mankind has ever seen. It took us centuries to eradicate this virus and has probably killed more than any other disease ever human survival has been ever monitored against a disease. Because this is a derivative of a same virus called smallpox, there is a huge concern and panic. And the reality is that monkeypox is a milder version of smallpox, but it comes from the same family. Now, one has to realize the fact that we did a massive vaccination program over decades to eradicate this. And it was only 1968 that we eradicated smallpox after human mankind. Now, what has happened is that the population born after 1968 or 1970, which is about 50 years and less, are never been vaccinated by smallpox, which means us as humans do not have any immune system, which are people below that age group, who've ever received a smallpox vaccine. And that is why monkeypox now brings a concern to humans which are below that age or never been vaccinated with smallpox due to low immune system in that regard. But monkeypox is still a very milder version of smallpox. Spreads very differently, spreads through human contact, but of a pox which is filled with vesicles and has a fluid. And when that fluid gets in touch with another human, which is through, you are having sex or kissing or you are hugging or touching hands, but it's only from the part where the fluid is active, moves from one person to the other. Most importantly, these vesicles are formed in the mouth or in the genital areas, and that is why sometimes while saliva or talking, the virus can move very quickly from one. The fluid is very contagious of this virus, and that's why this is a concern. A disease which was very zoonotic, which means spreads only from an animal to humans, a close proximity of a human to an animal like rats or rodents was how this virus was. So virus remained with us. Humans knew about this virus, but it was always a small outbreak of single digits or double digits. Not like this 31,000 people have suddenly been infected, because this virus has now mutated and have now developed what we call it as a human-to-human transmission. And these are concerns that we are seeing, a mutated a virus of monkeypox, which comes from a smallpox family, which is basically a disease which is very, very dangerous to mankind, eradicated from humans, have now started developing, though in a milder format, but the concern is it comes from the same subgrouping. We've seen this virus now mutating, now not only from an animal to human, but from a human to human. And these are the concerns scientists have. governments have, and that's why it's considered to be a disease of concern. WHO has recommended a disease of concern, and we are concerned. But we need calmness, no panic. It's still a milder version. Only 11 deaths all over the world. It's still 11 lives, but critically no life lost in South Africa. Very still small cases, and this can be curtailed because of the way it spreads.
We've been told by the health minister that the outbreak, particularly in South Africa, is still under control. But of course, there have been questions around vaccinations and what the approach there should be. What are the conversations that you at Higher Health are having?
So I think the good news is this is not like COVID-19 when we were caught in 2020, when we did not have any vaccine or did not know how to fight a virus that came absolutely novel to human mankind. This is something we know, and we have always had a smallpox vaccine. A smallpox vaccine has been absolutely effective, probably 85% effective already against monkeypox, and I'm sure science can quickly develop monkeypox vaccine in a very blink of an eye. Now, the vaccine in smallpox have two big features here. One is preventative, which means it can prevent the spread of infection from one human to the other, and it can lead into milder version of the disease, which means it will protect a human from a severe disease or deaths. But the second important critical factor which we have to consider in the smallpox vaccine is that, in this disease, because it spreads through a contagious fluid, it's not an airborne, but it spreads through contagious fluid, which means we can quickly identify what we call as ring contacts, which means we can ring fence the contacts, or we can do contact tracing of a particular case of monkeypox very quickly. And if we can provide vaccine to the ring contacts, which means the close contacts or proximity of people to the person infected with the virus or proven to have monkeypox, given within the first 5 days, this can even prevent among those close contacts with absolute reduced severity of the disease, which means we can save lives to this. So I think the reason of procurement of vaccine for Africa is critical, and learn from COVID-19 is to now be very proactive, engage the manufacturing system, WHO, and bring vaccines in every African state, including South Africa. And I'm sure the government is at this stage trying to procure vaccines for healthcare workers, for close contacts or ring contacts of all the people who will start getting monkeypox. At this moment, we have been able to curtail the virus very quickly, because the way we can do it is, as soon as the case is identified, we can closely monitor the close contacts, isolate them, and monitor that. But at one stage, we will need to vaccinate the ring vaccination people. Yeah.
Professor Ramneek, Ahluwalia, let's leave it there for tonight.